I am audible. Are you
Yes, sir.
okay? Uh, Welcome everyone once again. I request to Dr. Anjali Kuthe ma'am to start the her session. Anjali madam,
Yes.
you can now start.
But only the host can share in this meeting.
You also co-host. एक minute, one minute. Like co-host. Right. Okay, you can now share your screen.
Is the screen visible, everyone?
Yes, yes.
Yes, yes.
Okay. So, good morning, all of you. Let us start the next system. Am I audible clearly?
Yes, ma'am.
Yes.
So, we are continuing the system known as respiratory system. Every organism, or you can say every living being, having the process of respiration. So what is meant by respiration? Can anybody tell? What is the meaning of respiration? Actually, it is the process of combination of two processes, inhalation as well as exhalation. So what is the need of the respiration? Yes, anyone can tell me the need of the respiration.
Well, it's essential for the intake of oxygen, entering
For what
oxygenate the
purpose?
blood.
For what purpose we need oxygen?
The intake of air to oxygenate the body, the blood.
Yes, an organism requires not only the nutrition, right, but also the oxygen, which is very useful for our metabolic processes continuously going on inside the body. Our tissue continuously consume oxygen and produces the waste and even toxic gas. Which is that toxic gas?
Carbon dioxide.
Yeah, carbon dioxide, which is very harmful for the, life processes. So it is expelled out through the process of respiration. Now, for this purpose, there must be the continuous process for exchange of gases between the organism and the environment. So this is the need of respiration, and the two types of respiration are there. One is external and another is internal respiration. So we got the point that the system provides oxygen to each and every cell of our body, and it removes the carbon dioxide, which is harmful. Now, which are the various organs taking part in the process of respiration? So, major parts of respiratory system, they are the airway, the lungs, and various muscles. The airway, which includes our nose, mouth, pharynx, larynx, trachea, bronchi, and the bronchioles. All these are known as the airway of the respiratory passage. Then the lungs are another important organ, and various muscles. You can say the accessory organs, accessory muscles. For example, diaphragm, It is very important in the process of respiration. So, have you heard about diaphragm in the last lecture? What is
Yeah.
diaphragm?
It is
Where
large
it is located?
in the trunk.
Yeah. Its importance is that it divides our trunk into upper thoracic and lower abdominal cavity. So this is the muscular curtain, you can say, in the trunk region, which divides the trunk into two portions. So these muscles take very important role in the process of respiration. And other than this diaphragmatic muscle, some intercostal muscles. What are intercostal muscles? The muscles which lie between the ribs. How many ribs are there? We have seen. It will just revise the last lecture. So please try to answer. How many are the ribs? Miss Meena? Or anyone can answer. Yes, there are 12 pairs of ribs. And between two ribs, there lies the intercostal muscle, right? So these intercostal muscles, there are another muscles also, but we will not go so deep. Sternocleidomastoid muscle is also there. But look, the diaphragm and intercostal muscle, certain abdominal muscles are also important for the process of respiration. So these are the muscles. Now this is about the organs of respiratory system, the airway, the lungs, and the muscles of respiration. Now we have seen that there are two processes, the process of respiration, internal and external. Now, what is the function of the respiratory system? The passage of lungs, that means through the nose, the pharynx, the larynx, the trachea. This is all the passage. And it purifies the air. It gives warmth and humidifies the incoming air. How the process takes place? Let us see one by one. The nose, the very important organ of the respiration, that is the nose. It is externally visible part of the respiratory system. Air from the atmosphere, it enters through the nose, particularly external nares or nostrils. The, the nasal cavity, which is divided into right and left by a septum known as nasal septum, which divides the nose into two cavities, nasal cavities, right? If you see the structure of the nose, here it cannot be clearly mentioned. Okay. So nose, you can notice some small hair-like projections inside the nostril. All of you may have seen the small hair. These hair are nothing but the ciliated epithelial linings of the nose. These cilia means hair-like projections, right? These hair-like projections, they bend on one side and they rapidly sweep out all the dust and foreign particles, right? That means they act like a sweeper. They act like a wiper, and all the dust and foreign particles, they are removed and our passage gets purified. So one important point here comes, we can inhale through our nose as well as through the mouth. So which is very comfortable or which is a very correct method? Inhaling through nose or inhaling through mouth? Which is the correct one and why? This must be very clear. We can inhale through mouth also and we can inhale through nose also. Which is the correct way? and why? This is my question. Guess.
The correct way is through nose.
Sorry.
The correct way is through the nose because it
Yeah.
has the
You are,
purification and all of this.
yes.
The filtration happens in the nose, right?
That means just I have told you about the cilia. The ciliated linings, they are present only in the nose and they
Yeah.
sweep the dust and foreign particles. Such type of arrangement is not found in the mouth, right?
Okay.
Another important uh, reason behind that is our nasal mucosa is lined by the mucous membrane. And through this mucous membrane, some mucus, which is sticky substance, in this sticky substance, some dust and foreign particle get sticked up in the mucus. Such type of arrangement is also not found. And the most important one, the third reason behind that is there is a huge capillary network found in the nostril. If you observe a nasal cavity, you can see that it is reddish in color due to the tremendous blood supply. So here when the air enters from the atmosphere, if it is so cold, what happens? It gets somewhat warmth and it becomes warm as equal to our body temperature. And our lungs are protected from getting infected. So these are three reasons due to which uh, inhaling through nose is the correct way. Clear? Everyone? Can we go forward? Yes. Now next. Olfactory receptors are located in the mucosa. Olfactory receptors, that means there are 12 cranial nerves in our brain. And through these cranial nerves, we get the various sensations, various processes, or various functions in our body are easily going on. So olfactory nerve, it is one of the cranial nerve. We will see details about the olfactory nerve and all that while studying the nervous system. So here olfactory nerve is very important for the process of sense of smell, right? The rest cavity of the nasal cavity is lined with the respiratory mucosa. So this is our upper respiratory tract. The nasal passage, the pharynx, larynx, trachea, all. The hard palate, the soft palate, you can notice here. The epiglottis, we are going to learn about all these. The cartilages, just observe the diagram. Observe the location of the esophagus, location of the trachea. Trachea lies anterior to the esophagus. Trachea is called as windpipe and the esophagus is food pipe. It lies the trachea lies anteriorly while esophagus is posterior to the trachea. Observe the location of thyroid gland and there are the cartilages are larynx. Larynx is known as speech box or voice box and it is made up of various types of cartilages. Just observe it. Now we will continue the various organs one by one after nose. Now then certain there are sinuses, paranasal sinuses. What are sinuses? These are the cavities within bones. We have seen various types of bones in the facial region. Yesterday we have seen the facial bones. So the cavities within bone, they are surrounding the nasal cavities are the paranasal sinuses. And their important function is resonating the chambers for speech. Now about the pharynx. After entering through the nostril, air enters the pharynx. What is pharynx? pharynx is the muscular tube-like again the structure, and our mouth cavity also opens into the pharynx, and nostrils also open into the pharynx. So it is the common passage for food and air, right? So there are three divisions of the pharynx. Pharynx is divided into three parts: nasopharynx, oropharynx, and the third one is laryngopharynx. Nasopharynx is the superior region. It is behind the nasal cavity. Oropharynx is middle one, and the laryngopharynx is inferior region, which is attached to the larynx part. This is about the pharynx, the muscular tube-like structure, and also it is lined by the mucous membrane. Okay. Now about the larynx. Larynx is known as speech box or voice box. It lies in front of the lowest part of the pharynx. That means when pharynx ends, that's starting of the larynx. It acts as a protective sphincter. Its function is very, very interesting. It is the protective sphincter like part. It prevents solid as well as liquid from entering our respiratory passage. It protects our respiratory passage from getting from entering any food or water particle, right? So it is composed of 8 cartilages. What is cartilage? We have seen the very soft bone, and larynx is made up of various types of cartilages. One of the cartilage is known as thyroid cartilage. Another are cricoid and arytenoid cartilage and all that, but we will not go so deep. You just remember about the thyroid cartilage. Out of 8 cartilages, thyroid is one. And what is its importance? It is the largest cartilage among all. And here the thyroid cartilage, it lies inferior to the epiglottis, and it is also known as Adam's apple. So note that it is very important point. So it is known as what? Adam's apple. And in the adult male, particularly in adult male, it is clearly noticed. It is clear, it is somewhat enlarged, and it is visible also, right? So this is about the Adam's apple. There lies the spoon-shaped flaps of elastic cartilages, that is known as epiglottis. Epiglottis, it is the opening of the larynx, you can say. Its function is also very important. And here lies the vocal cords also. It can be the glottis. The main important part to be noticed is it is narrow and air is directed towards vocal cord during expiration. So vocal cord vibrates and the sound is produced. So it is also known as voice box or speech box because it helps in the production of speech due to the vocal cords. The vocal cord get tense and relax. Depending upon the alter, we can alter our speech. So the functions of the larynx are protection of airway, regulation of airflow to the lungs, and production of the speech. These are important functions of the larynx. Now next about the trachea. Trachea is also known as windpipe. Trachea is known as windpipe. It is also the tube-like structure. Here in the diagram, you can see the structure of the trachea. It is again the tube-like structure, near about having 12 centimeter in length, and it splits into 2 parts. One enter the right lung, another enter the left lung. That means it is known as right and left bronchi. The trachea at the level of T4. T4 means thoracic fourth vertebra. How many are the vertebrae in a vertebral column? We have seen the structure of the vertebral column yesterday. And yes, vertebral column consists of 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal. But here, the 12 thoracic vertebra are there, and out of 12, at the level of 4th thoracic vertebra, the trachea gets bifurcated, and one of its branch known as right bronchus and another is left bronchus. Right enters the right lung while left enters the left lung. The trachea is 12 centimeter long and it splits into right and left lungs. Also, walls of the trachea, they are lined by the C-shaped fibrocartilaginous rings. Observe the structure of trachea and you may notice certain rings. They are arranged one above the other. How many are the rings? Near about you can say 17 to 19 fibrocartilaginous C-shaped rings are there. One important reason is behind that. We will see later on. So it is lined by the ciliated mucosa also, just like the nasal cavity. That means the ciliated epithelium, mucous membrane. It is not lined in the nasal cavity alone, but all over the respiratory passage. So nature has given very good protection to our lungs from getting infected due to the presence of these ciliated, you can say ciliated type of epithelium and mucous membrane and all that. So these are lined all over the respiratory passage up to the bronchi. So now it is lined by the ciliated mucosa and C-shaped fibrocartilaginous rings. And another important function of the C-shaped cartilaginous ring is that these are located anteriorly. So and posterior to the trachea is esophagus. So what happens when we take food? The esophagus is expanded and the trachea is pushed only from the posterior side. Esophagus get expanded and trachea is pulled from the posterior side. And also due to these C-shaped rings, our trachea becomes rigid and cannot get collapsed. So to maintain the passage permanently open, the respiratory passage must remain permanently open for easy exchange of gases, right? So due to this reason, the C-shaped cartilaginous rings play a very important role in this process. Yeah. Now next is the bronchi. Now after entering the lung, right and left bronchus enter the right and left lung respectively. Now what happens? After entering the lung, just like the branching of a tree in the slide you can notice, just like the branching of a tree, it divides and redivides and redivides and finally it enters, terminates into the air pockets. It is formed by the division of the trachea. Okay, and right bronchus and left bronchus. Right enter the right lung. As compared to the left, right bronchus is wider and shorter than the left one. Right. So this is the clear picture of the bronchial tree after entering the trachea. Right now, the after entering divide and redivide continually smallest divisions, and lastly they terminate into the air pockets. How the air pockets look like, we will see in the slide. See, like the bunch of a grape, you can notice these are the alveolus or air pocket. Lastly, it get terminated into the air pocket. And the wall of the alveoli are very, very thin. We will see later on the structure. Now about the lungs. How the lung look like? They are conical in shape. And these lungs occupy most of the part of thoracic cavity. We have seen the structure of thoracic cavity yesterday. How is the structure of the thoracic cavity? Yes, can anybody tell me? Structure of thoracic cavity. In the front region, which bone is present? Sternum. And both sides, there are 12 pair of ribs. Now, in the cavity, there lies most of the space is occupied by the lungs. Lungs are conical shaped organs having apex and base. Apex of the lung, you can say it touches the middle 1/3 part of the clavicle bone or collar bone. 1 centimeter above the clavicle bone, there lies the apex of lung. What about base of lung? It is somewhat concave in shape and it rests on the diaphragm. Note the point. The base of the lung, they lie on the diaphragm, right? When we see the structure of the lung, you may notice that it is spongy in nature. 90% air is present and 10% only the tissue found in the lung. And the color of the lung is, in childhood, you can say it is somewhat a pinkish in color, and it becomes grayish, and due to aging or due to deposition of the carbon dioxide and all, it becomes somewhat blackish in color. That means color changes. Very interesting part. Lung having the coverings known as pleura. Lungs are very important organs, or you can say the vital organs like heart and lung and brain we have seen yesterday. And naturally they are protected by the bones. So bony cage, in the bony cage, lungs are protected, and not the in the bony cage protects the lung, but also there is some covering. That covering is known as pleura. Pleura is the covering of lung. There are two coverings actually. One is outer, known as parietal pleura, and another is inner covering, known as visceral pleura. These are the two coverings of lungs, parietal pleura and the visceral pleura. And between these two coverings, certain fluid is present. That fluid is known as pleural fluid. This pleural fluid fills actually the layers, and it helps to prevent the friction. What is the importance of the fluid? It prevents the friction during the process of inhalation and exhalation. What happens? Lung get expanded and volume is reduced during inhalation and exhalation. So to avoid friction between the lungs, it is required the fluid. Now, when we see the detailed structure of the lung, we can notice that in the right lung, there lies the fissures. Here, in the right lobe, there are two fissures. You can notice in the diagram. whereas in the left lung, there lies only one fissure. So due to these two fissures found in the right lung is divided into three lobes: superior lobe, middle lobe, and the inferior lobe, right? Superior, middle, and inferior. Whereas the left lung having only one fissure, so it is due to this fissure, it divides into only two lobes: superior lobe and the inferior lobe only. That means three lobes are there in the right lung and two lobes are found in the left lung. Okay. Also about the weight of the right lung is somewhat greater than the left one. 570 to 60 gram is the weight of the right lung, and comparatively 70 or 80 gram weight is somewhat difference between the right and left lung. So what we have seen about the structure of the lung? Again, I am revising it. Lungs are conical in shape, having apex and base. Apex is conical. It reaches up to the tip of the clavicle, somewhat 1 centimeter above the clavicle, and base is concave. It rests on the diaphragm. 90% of lung is made up of the spongy tissue, and it is divided into three lobes: superior, middle, and inferior, whereas the left lung is divided into only superior and inferior lobe. Now, the gap. You can notice in the diagram, the notch for the heart. There is a notch for the heart in the left lobe. And the gap between the two lungs, it is known as mediastinum. What is mediastinum? The gap between the two lungs. And here at the right lung, a notch is seen, and that notch is for the heart. So where heart is located? Between the two lungs, particularly 2/3 part of the heart, it lies in the left side, right? Here lies the cardiac impression. So this is all about the structure of the lung. Also, we have seen the covering and the structure of the bronchial tree. These are the bronchioles. Bronchioles, these are the smallest branches of the bronchi. Smallest branch. All but the smallest branches having cartilage. That means cartilages are found all over. Terminal bronchioles and end in the alveoli. This is the structure of the alveolus. Single alveoli, it consists of the duct, alveolar sac, and proper alveolus. And actual gaseous exchange take place within these. If you notice the structure of the alveoli, it is very thin and transparent. The wall of the alveolus is very thin and transparent, and so easily gaseous exchange can take place through this wall of the alveolus, and it is surrounded by the capillary network. You can notice here, each and every alveolus is lined by the capillary network, and here the pulmonary capillary, they surround the alveolus, and gaseous exchange take place here. We have come across about the events of respiration. What is pulmonary ventilation? Moving air in and out of the lungs. We have seen the two types of respiration. External respiration, it is the gaseous exchange between the pulmonary blood and the alveoli. So what is pulmonary blood? add pulmonary artery, pulmonary vein, and the capillaries. Don't get confused. I will explain details while in the next lecture during the circulatory system, because the pulmonary artery which carries the impure blood, it comes from the right ventricle, and it, through the pulmonary veins, and it comes towards the um, lungs for purification of blood. So this is pulmonary blood and alveoli. The gaseous exchange take place. It is the external respiration. And internal respiration, it is also known as tissue respiration. You will be very clear for the process of internal respiration, particularly when we will learn details about the cardiovascular system. Here, just remember the gaseous exchange between blood and tissue cells. It is the internal respiration. So here is a rough idea regarding the gaseous exchange. It takes place in the alveolus. The oxygen and carbon dioxide. The oxygen which we have taken, the passage, it travels. What is the traveling route of the oxygen? From the atmospheric oxygen through nostril, then pharynx, then larynx, the trachea, bronchus, bronchi, bronchiole, alveolar duct, alveolar sac, it enters the alveolus, right? So this is the passage. And when the oxygen enters the alveolus, it is, I have told you, it is very thin and transparent membrane, and here the gaseous exchange take place. It is surrounded by the capillary network, and through this it diffuse into the blood. Now the process of inspiration. What happens during the process of inspiration and during the process of expiration? Which type of movements takes place during the process of inspiration? Let us see. Anybody having query up to this? Can we go? The process of inspiration. Inspiration, the process of inspiration. What happens when we inhale the atmospheric oxygen, right? Our atmosphere contains the mixture of gases, oxygen, carbon dioxide, carbon monoxide, and all, nitrogen, and all that. But it is not a part. When we inhale, what happens? Our diaphragm get contracted and the rib cage rise up. You can clearly see in the picture. Our diaphragm descends down. It gets contracted, and the intercostal muscles, they lift the rib cage. And so what happens? It expands the volume of the chest cavity. The chest cavity, the dimensions, they are expanded. The dimensions of the thoracic cavity get expanded, right? So the chest cavity is sealed, so this creates a vacuum inside the cavity. So atmospheric pressure fills the lungs as air rushes into the breathing passage. What happens due to the expansion of lung? Pressure inside the lung get reduced due to the expansion. The pressure in the lung get reduced. And reduce means what? It get reduced. That means it less than the atmospheric pressure. Atmospheric pressure is near about 760 mm of Hg. That means it becomes very low as compared to the atmospheric pressure. So to make the pressure equal, what happens? Air rushes towards the atmosphere to the lung, from atmosphere to the lung. So this is the mechanism during the process of inspiration. The dimensions get expanded, the lungs become expand, the volume of air get reduced, and so the atmospheric pressure to become equalized gets entered. Now what happens during the process of expiration? After often exhaling is the passive event. When the rib cage lowers. Now what happens? When we expire the air, the rib cage or a rib moves downwards. Diaphragm ascends. The diaphragm, which was descended downwards, it get ascended. That means it get relaxed. The rib cage also comes towards its original position, and due to this, what happens? Now the pressure in the lung is greater than the atmospheric pressure. So the lung get pressed and all the air is pushed out of the lungs. This is the actual mechanism of the process during expiration. What occurs during expiration? The rib cage, which was lifted upward, it comes to its original place, and diaphragm, which was contracted, it comes to the original place. That means it get relaxed, and due to this, what happens? The lung get pressed, and all the air, it gets particularly the carbon dioxide, which was entered through the alveolus, it gets expelled out. So this is the process of expiration. Some non-respiratory air movements also occurs. We can say that they are the reflexes or voluntary actions during coughing and sneezing. These are the non-respiratory air movements in the air passage. Actually, it clears the lung debris, whatever the debris may enter due to this reflex mechanism. What are reflexes? They are the protective in function, the protective processes, or they are voluntary. Sometimes they are voluntary. Laughing, crying, yawning, hiccup, all these are the non-respiratory air movements. So now one must know about the respiratory volumes, and it is measured by the spirometer. You can see the spirometer. Spirometer is the machine with the help of which we can count the respiratory capacity. Normally, some important definitions you must know, the basic level. Normal breathing, during our normal breathing, that means when you are sitting very quietly and inhaling and exhaling very quietly, very simple. So the normal air, the air which you are inhaling, and during the process of inhalation and exhalation, that is the movement of the air, that is 500 ml. It depends upon certain factors, and the capacity, respiratory capacity, it affects certain factors like the person's size, sex, age, and the physical condition. Also, it impacts the capacity of the lung. What is residual volume of air? It is the air after exhalation. When we exhale, we think all the air which we have expelled out, but it is not like that. Some air always remain in the lungs, and this is the residual volume. It is near about 1200 ml. Now the most important point about the control of the respiration. Actually, respiration is the process having semi-control, not fully in our control. It is, we can say, it is semi-involuntary in nature. Respiration is the process which is semi-involuntary, And actually the center of the respiration is located in the medulla oblongata. What is medulla oblongata? It is one of the part of the brain. We will study details about the while learning the nervous system, right? So medulla oblongata controls the process of respiration. And here, when there lies the chemoreceptors, baroreceptors and stretch reflex, this mechanism actually is very complicated. But in very simple terminology, I will explain you that our medulla oblongata in this respiratory center, chemoreceptors are located, and these are very sensitive for increased level of carbon dioxide. When there is increased level of carbon dioxide, what happens? The nerve impulses make the diaphragm contract and bringing air into the lungs, and the respiration is maintained. The control of respiration, you can say voluntary and involuntary. It is semi-voluntary, I have told you already. Also, our emotions play important role in the process of control of respiration. What happens during tension, anxiety, fear, fright? The rate of respiration becomes rapid, right? And the depth also get changed due to certain mechanism or certain hormonal processes. These are you can say it control. That means control of respiration. In control of respiration, emotional status of the person also plays important role. Now, respiration rate throughout the life. In a newborn baby, it is 40 to 80 per minute. While in the adult, it is about 12 to 18 per minute. Generally, the ratio of the cardiac cycle or cardiac activity, the heart rate, it is about 72 beats per minute, and the rate of respiration is 18 beats per minute. That means 1:4 is the ratio between the respiratory rate and the rate of heart. 1:8. And age-wise, if we consider in old age, the rate of respiration becomes higher. So this is all about the respiratory rate throughout the life. In newborn, in infants, as the age increases, the rate of the respiration, it slowly comes down, right? This is all about the process of controlling of the respiration. And here we have completed the system known as respiratory system. We in this respiratory system, just I will revise it again very fastly. We have seen what is the process of respiration, what is the need, and various organs of respiration we have seen. And also we have seen about why there is the correct way of intake of oxygen is the nasal cavity and not through the mouth cavity. We have seen 3-4 reasons behind that. Then we have seen the various functions of the respiratory system, gaseous exchange and the purifying, giving warmth to the air and humidifying the incoming air. This is the exact functioning. Then we have seen the structure of the nose, small ciliary hair-like projections. They play very magic role in the process of wiping out all the dust and foreign particles from entering the respiratory passage. So to prevent the entry of any bacteria or any foreign body in the respiratory passage. Also, the nostril is lined by the ciliated type of epithelium and mucous epithelium. And we have seen that these protective mechanism is not found only in the nose, but is present all over the respiratory passage. Our trachea, our bronchi, and all. Then we have seen the upper respiratory passage, the sinuses, the pharynx, the muscular bag-like structure. And here it is divided into three parts: naso, oro, and the laryngopharynx. And oropharynx and the laryngopharynx. These are the common passage for food and air. Then we have seen about the larynx, which is known as speech box. And the important point, it is made up of various types of cartilages. One of the cartilage is thyroid cartilage, which is largest one. And it is also known as Adam's apple. And it is more visible and prominent in the adult male. And it, the uppermost part of the larynx, it acts like a flap, and it protects the airway from getting entry of food or air particle in the esophageal tube. Then we have seen the trachea, which is 12 centimeter long, tube-like structure, having C-shaped fibrocartilaginous rings lined by mucosa. And we have seen that it is a C-shaped cartilaginous rings. What is the function of C-shaped cartilaginous rings? It helps to remain the trachea permanently open for the gaseous exchange. If the C-shaped cartilages are not present in the trachea, what will happen? The trachea will get collapsed, and so the passage will not be very easy. And the collapse occur during the asthmatic and other conditions. Primary bronchi, and this is one of the division of the trachea. The trachea, when it enters the lung, it divides, redivides, and redivides like the branching of a tree. And smallest branch is known as bronchi. Then we have seen the structure of the lung. They occupy most part of the thoracic cavity, having conical shape. 3 lobes are there in the right, 2 lobes are there in the left. Having apex, which is conical, and base, which is concave. And in the right, in the left, there lies the cardiac notch. Here the heart is found. Then we have seen the covering of the lung, known as what? Pleura. Pleura are the coverings. The 2 coverings are there: outer parietal, inner visceral covering, and between the 2 covering there lies the fluid known as pleural fluid, which gives lubrication and prevents the friction. Then we have seen the smallest branch known as bronchi, multiple bronchioles, smallest branches. And the terminal bronchiole in the alveoli. So this is the structure of the alveoli. Gaseous exchange actually takes place here in the alveolus. Then we have seen the types of respiration and gaseous exchange between the pulmonary blood and alveoli, and the tissue level respiration, that is known as internal respiration. Then how the process of, what is the main function of the lung? It is here the purification of blood takes place due to the exchange of gases. Then we have seen the mechanism of the inspiration and expiration. what happens during the process. Certain non-respiratory movements and certain respiratory volumes. Don't get confused. Only just remember the spirometer, which is the machine with the help of which we can count the respiratory capacity. Near about 4 to 5 liter is the capacity of an adult human being, and the capacity affects certain factor which include the size, sex, age, and certain physical condition, right? And these are some respiratory volumes. And lastly, we have seen about the breathing control, as it is the semi-involuntary, but mostly it is controlled by the respiratory centers, which is located in the medulla oblongata. And this center is very, very sensitive about carbon dioxide level. When the carbon dioxide level increases, what happens? It gets stimulated and the nerve impulses make the diaphragm contracted, bringing air into the lungs, and the rate of respiration get increased and depth also increases, and all the excess of carbon dioxide is expelled out through the lungs. Lastly, we have seen about the respiratory rate throughout our life. It's the in newborn it is very fast, and in the adult it is about 12 to 18 per minute. And when you will learn about pranayam, the yogic practice, it is one of the best practices in the yoga, and through yoga we can it is very helpful for increasing the capacity and to become calm and quiet, because when your respiratory rate of respiratory goes down, it will calm down your mind. It is a magic will happen with you, and your brain and the thought process will get very lowered, and all the thought process will stop, and you will feel very relaxed and no while practicing. It is the experiential process actually. The rate often increases with the old age. So this is all about the respiratory passage, respiratory system. If anybody having query, you can ask me, or I will ask you. We have some time, so we can check.
I have a question.
Yes.
It's about the respiratory system. Okay. About cold air. When you practice yoga, should it be done in cold air, and does it have an effect on the respiratory system, or should it be warm or room temperature?
Yes, always you should do the pranayama and deep breathing practices. You should maintain the environment. Atmosphere must be proper, ventilation must be there, but it not include very cold air, right? The ventilation should proper. It may
What about air
affect the,
condition? Should be off?
sorry,
Air condition.
no, air condition, the ventilation. I'm saying about the ventilation. That means proper ventilation must be there, not very cold and not very actually hot.
Okay, so we should switch off
Atmosphere should be pleasant one.
any. Yeah. Okay. Thank you.
You got the respiratory system, its anatomy and physiology. Anybody?
I would like to talk about the nose also.
Yes.
We have both sides of the nose. So what is the purpose of this, and what effect does it have on the respiratory system? Right side and left side.
Rohit, you can inhale the nostril. Actually, it affects. The yogic science can give its answer very briefly, right? What happens when you inhale through the left nostril? Yogic science mentions that there are two nadis, Ida and Pingala nadi, right? And through Ida is located towards the left nostril, whereas Pingala nadi is located in the right nostril. Ida is known as Chandra nadi, which gives cooling effect, whereas the Pingala nadi, which gives it is known as Surya nadi, it gives warm effect. That means when there is increased heat in your body, you can do the process of pranayam or respiration through the left nostril, and which gives cooling effect, right? And when there is need of good appetite and good digestion, some heat is required, or then you may need the Surya Bhedan pranayam, which increases heat in your body. So Ida and Pingala, which are located in the left and right nostril respectively, they maintain actually the what you can say, they help in the process of metabolism also, and various processes, their effect occurs on our body. So yoga can give the good answer for your question, that is the right and left nostril. And through pranayama or through nadi shodhan pranayama, you may have learned about nadi shodhan pranayam, the balance between the Ida and Pingala. It is, and another nadi is known as Sushumna nadi. It balances all the functions of our body. So the pranayama technique is all very, very effective for maintenance of the respiratory and all, I can say, all our body systems. Homeostasis process is maintained through this. As you will learn the pranayama, you will get very clear answer. Yes.
Okay. Any other questions?
No, all clear.
Okay. Daniel, please. Okay. Thank you so much, ma'am, for your wonderful session. Next session will be held next Saturday, same time. Okay. Hari
All
Om.
right.
Yes.
Hari Om.
Hari Om.
Hari Om.
Hari Om, all of you.
Thank you.